My name is Lizzy Quinn. I'm a musculoskeletal physiotherapist. I'm based in Ashgrove in Brisbane, and I work primarily with women who are experiencing persistent lower back pain. Lower back pain is a really complex thing to treat because it's not just looking at the changes within the back tissues and the discs and the joints that we need to be considering when we're trying to approach a treatment plan for a patient, but we really need to look at the whole person and what's happening. And the reason why this creates complexity in women is that women have really busy lives. They have a lot of pressures and expectations on them, particularly in their 30s and 40s and 50s. And it means that we need to look at their emotional pain as well as their physical pain to try and give them good recovery for their persistent lower back pain. So when a woman comes in to see me, often I'll speak to them not only about their back pain, but also about how they're feeling in themselves, because stress, fatigue, overwhelm, anxiety and depression play quite a significant role in driving our symptoms of lower back pain, and a lot of women don't realise that. So by the time they've come to see me, they've often seen 10 or 20 different practitioners, and they're working really hard to try and get rid of their pain. And they're stretching their back and getting massages and heating their back a lot and trying to improve their symptoms, but not realising that there's quite a big impact on how they're feeling in themselves that's driving some of their symptoms. And unless they're educated on that, it's really hard for them to get good long-term recovery from their pain. There are some limitations, and I feel really sorry for GPs when they're attempting to treat people with persistent lower back pain because they actually just don't have the time to do it. So educating patients and helping them to understand about the complexity of lower back pain is really important. And that's why I'm in such a lucky place in that I will spend a whole hour with my patients speaking to them about pain psychology and pain processing so they understand what's going on. But there are limitations. So I think the more that health professionals who are dealing with patients with lower back pain can educate themselves on best practice and what the most recent science is showing us will allow them to give them the best chance to access the most helpful recovery platform. But I do find it is really challenging, and I do feel sorry for GPs who are placed in such a time crunch to try and get those messages across to their clients. What's happened over the last 10 years is we've all of a sudden got access to imaging, which we didn't have 20 and 30 years ago. So all of a sudden there is an MRI machine on every corner in every suburb where patients can get a referral from their GP or their physio or their health practitioner to get imaging of their spine. But what has happened is that we're seeing evidence that the more information, particularly when it comes to imaging, the worse outcome the client may have. So when you go and get a lower back MRI, for instance, the radiologist has to report exactly what they see. So they'll list a lot of words that sound really scary, like disc prolapse, disc protrusion, degeneration, osteophytes, arthritis. And any patient who reads that probably thinks this looks and sounds really bad, not realizing that after 25 to 30 years of age in your life, everyone who gets an MRI or anyone would have similar findings. Changes within our spine are really normal. They're actually just a sign of aging. So looking at MRI findings generally provides us with not much information on how to actually recover from pain. There's only a certain number of people that actually should get imaged, and those are people who have got persisting and really bad night pain, which means their pain only comes at night. They have changes to their bladder and bowel function. They have pins and needles and numbness in that area, or pins and needles and numbness that are not going away in their legs. So there's only a small amount of people typically that do actually need imaging straight away. The majority of people, so 95% of the population, not only will the MRI be unhelpful, but it won't tell us anything about why their pain is persisting. So lots of clients who come to see me for the first time bring their MRI report, and I read it and I explain to them how generally it's unhelpful. It won't change the way that I treat them, but understanding that those findings are age-related, they're normal. So we're taking the client from thinking that they're damaged and injured and moving them into a space of sensitization. And that narrative is very helpful for their recovery. What makes the persistent lower back pain so complex to treat, and what most clients who come to see me don't understand is that their brain cannot tell the difference between physical pain and emotional pain. So there are a couple of primary centers in our brain, like our anterior insula and our anterior cingulate cortex, that actually process both. So they process not only our pain processing into our lower back, but they also process how we're feeling. So there's neural overlap between those two centers. And what that means is if you've got sensitization, basically overactivity within your pain centers that have been lit up as a result of having persisting pain, but you're also going through a period of stress or fatigue, anxiety, and overwhelm, it makes it really hard because that area that's been sensitized for a while will be reactivated when you're going through emotional distress. So unless you realize that, it can be really hard to try and improve your lower back pain because you're continuing to facilitate the sensitization in your brain, even if the recovery within your tissues in your lower back has already been done. So there's no reason why your tissues need to be sensitized anymore. Your healing's being complete, yet you're still feeling pain in your lower back. And so understanding that complex combination of neural overlap between your pain centers and your emotional centers are really important for clients. I think one of the most important things that we can do for our clients is to actually educate them about the main drivers of their lower back pain. So when people come in to see me, one of the first things I tell them is that your pain is driven through two primary channels. And basically that is your tissue sensitivity in your lower back. So often your back will feel like it's a bit bruised or it feels sore, but it actually probably has very little to do with the joints there. It's more to do with the tissues becoming very sensitized. And then the other primary driver is really your hypersensitization that occurs within your pain centers in your brain. When you explain that to them, it makes it so much more easy for them to understand why their pain's been persisting the whole time, even when they've been doing everything right, doing exactly what their health practitioners or whoever they've been seeing have been telling them to do. They've been repeating those things and it's not getting any better. So educating clients about the main drivers of lower back pain is really vital. Otherwise, it makes it really hard to get any consistent long-term recovery.